Have you ever wondered how artificial intelligence is helping solve medical problems? Or how medical research is making it easier to predict your genetic risks for disease? Hi, I'm Kathy Werzer. Tomorrow's Cure, a podcast from Mayo Clinic and PRX, is back for Season 2. Join me as I interview experts who are shaping the future of healthcare with groundbreaking advancements. What they describe may sound futuristic, but listen and you'll find out. Tomorrow's Cure is already here. Find it now wherever you get your podcasts.
This is Aging Forward, a podcast from Mayo Clinic about the science behind healthy aging and longevity. Each episode, we explore new ways to take care of our long-term health, the health of our loved ones, and our community, so we can all live longer and better. I'm Dr. Christina Chen, a geriatrician and internist at Mayo Clinic in Rochester, Minnesota. In this episode, we are talking about fall prevention. Every year, more than 1 in 4 adults over the age of 65 experiences a fall. In fact, falls are actually the most common cause of injury and injury-related death in older adults. But why is it that they happen more as we get older? And what can we do to prevent falls and keep ourselves safe? Our guest today is Dr. Paul Takahashi, a geriatrician and internist who has been recognized many, many times for his exceptional teaching, research, and clinical skills. He works in the Department of Community Internal Medicine, Geriatrics and Palliative Care at Mayo Clinic in Rochester, Minnesota. Welcome, Dr. Takahashi, and thank you so much for being on the show today.
Well, Christy, thank you for having me. I'm really excited about talking about falls. I think this would be a great discussion today.
So falls are one of the most common problems we see in older adults, and I think it's one of those conversations we don't talk about enough. And I think it's helpful for our general audience to understand, what is the prevalence of this and how often are you seeing it in your practice?
It happens very, very commonly, Christy. Not a day goes by that I don't see somebody who's fallen or has fallen recently or is coming out of the emergency room after a fall. And I think you said 1 out of 4 people over 65, but as people get in their 70s and 80s, it's even more common, probably 1 in 2. So it really becomes a really common issue. And I talk with people about this because a majority of folk, what they really want to do is they want to stay at home, they want to stay healthy,
Right.
and trying to prevent these falls is such an important part of that.
What are the most common causes of falls? Why are older adults falling more often than, say, a 20 or 30-year-old? What's the underlying theme here?
So it's not just one thing, Christy. It's a lot of different things. So as we get older, we start developing illnesses. We start having things that make it harder for us to get around, or our endurance starts to change. Our muscles start to change. We start becoming a little bit weaker. It becomes harder to get around. The nerves in our feet start to give us more challenges. We start having more problem with our vision. The inner ear is a really important organ to help out our balance, and that doesn't work quite as well either. So people take lots of medicines. There's lots of different reasons why this starts to happen. So you put all these things on top of each other, and all of a sudden people are in higher and higher risk of falling.
Can we just comment a little bit about why this is such a problem? Why are falls just so detrimental to older adults and the largest cause of injury-related death? Like, why is it such an important thing that we're talking about today?
Why is it such a big deal? I'd say for a majority of people, particularly when we get into our 70s and 80s, what they really want to do is stay at home. They want to stay independent. They want to be able to do what they enjoy doing, be that their activities or staying at home. When people fall and they get injured, break a hip, break a back, it causes a lot of pain, discomfort, a lot of disability that goes with it. When people break a hip, a lot of those individuals will end up forever being disabled. I mean, they may end up having to use a walker or a cane. A lot of those folks can't get back home. If somebody is unfortunate enough to have a really bad injury, they could have a bleed within their head, and that could be life-threatening. Or they have a hip fracture, and they get ill, and they don't get out of bed very well, and they get pneumonias, and they get other infections. So it becomes a very quick spiraling downhill that causes so many health problems. And so we tend to think about bad things like cancer and heart disease and heart attacks. But I look at hip fractures being one of the really bad players that people can have. I think increasingly people are recognizing this. They're saying, you know what? I don't want to have a hip fracture. I don't want to end up leaving my home. I don't want to end up having to go to a different level of home. They have a bad injury. They have stairs. Now they can't stay in their home. Maybe they can't stay in their apartment anymore. So that's why we really try to prevent these falls.
Yeah, it's really the biggest threat to independence. We both work in nursing homes, and looking back, if I look through the charts of more than half of the people in the nursing homes, there was some sort of fall-related issue that landed up there. And then it's been
Absolutely.
like recurring over and over again to the point where it's not safe to stay at home anymore because their environment is not safe, right?
Absolutely. They lose strength, they lose ground, they lose functional ability, and all of a sudden, all those compression fractures of their back
Mm.
or that hip fracture just never really healed right. Now they're falling again and they just can't maintain it. They can't get up and down the stairs. And they say, well, I have to give up the home.
Do you get concerned when someone comes in to say, oh, I tripped over a stool, or I just stumbled over my feet? I mean, there's different types of falls that are unanticipated, some that are more accidental, but a fall is a fall.
A fall is a fall. Basically, when a young person kind of stumbles over their chair, they catch themselves, right? They have good balance and they don't fall down and definitely don't get hurt. So that's the other part of the fall question here is as people get older, they become more injured as well as falling more frequently. So it's a combination of both of those. And that's what really becomes the challenge.
That makes a lot of sense with so many different risk factors to account for that in combination or compounded, it puts someone at highest risk. But what do you feel like are the biggest risk factors?
So the most important risk, the one thing we know really does predict falling is people who've had previous falls. So once you've had one fall, then you're at a really, really high risk for having another fall. So when I'm talking to people about falls in the office, the most important question I'm going to ask is going to be, have you fallen?
Mm-hmm.
And if you've fallen, are you afraid of doing this again? Have you gotten injured in the past? So if you're talking to loved ones who've had a fall, they're at high risk.
And that's why asking them that question is so important, is usually they won't tell you or they'll try to conceal it because it's embarrassing in many ways.
Absolutely. It's incumbent upon all of us to ask that question. Or if we have a loved one who's had a fall, talk to our loved one, or if it's ourselves, and say, hey, I've had a fall. I'm really going to need to do something differently to make a change because I'm at really high risk of having another one down the road. And luckily, maybe that first time you didn't hurt yourself, but the next time you may. And so we want to do things to help prevent falls from happening in the future.
And I love that we're talking about risk factors because I think there's a lot of risk factors we don't think about, other considerations that can add to fall risk. What are some other things?
There's a lot of things that we can do to change that will make things a little bit better. And certainly parts of this, like we said, when we talk about accidental falls, is there an environmental component of this? With so many different things causing falls, some of them we can change and some of them we can't easily change.
Right.
Maybe you're having a problem with vision, or maybe you're having the inner ear's a little tougher to fix. Medications are always on there if people are having medication issues. Other common reasons, we don't always talk a lot about alcohol use, but certainly alcohol can play a role here as well. And other things in terms of just strength in the legs and mobility and using mobility aids. So identifying a few of those things we can fix quickly can really help prevent falls in the future.
And what about cognitive decline? How does that present as a risk factor?
So the reason why the cognitive decline is such a big deal is because when people have cognitive decline, dementia primarily, they're not really well aware of their limitations, or they may forget their limitations. Frequently, they do not or will forget to use gait aids. Your loved one is supposed to use their cane or their walker, and they forget to use it. Or commonly what happens is if people do have some cognitive issues, they've had a fall or injury, it's hard for them to learn how to use these type of things. It's hard for them to do the therapy or to remember to do exercises. So the dementia doesn't necessarily cause the fall per se. But what it does do is it prevents the good treatment and prevention of falls, which means that they're more likely to have that happen again. As opposed to other issues with cognition, such as like Parkinson's disease, which directly affects the ability to move. And it's like, boy, it's hard for me to move my feet. And then you fall with that, or your posture's off with Parkinson's disease and you fall forward. This cognitive decline is a big issue primarily because, again, people just are not aware of it. They don't think about it and they don't try to actively prevent it. Whereas I think people who have good memory, have good insight into this, really try to work hard and say, I've got to be careful. I've got to use my walker. I shouldn't do this at this time of day. There's ice outside or something like that. They can plan better, basically.
And one thing I like to share with patients that makes it more understandable is, the brain controls everything. The brain is our central nervous system. A dysfunctional brain eventually leads to a dysfunctional body. They work hand in hand. They work together. You have to have a healthy cognitive baseline in order to have a healthy physical baseline as well.
The other thing that happens with the memory issues, of course, is people tend to not move around as much. And that's the other part that happens with this too. So when we've looked at this in our studies, we've seen that it's that combination of dementia and frailty is a really, really bad combination for landing in the hospital, much more so than each of them independently.
So most people in their middle-aged years, for example, like myself, I hate to call myself middle-aged, but I am. We often don't think of falls as a problem to be concerned about because last time I fell was, 6 years ago when I slipped on ice. And that seemed like, a common occurrence. But should we be thinking about fall risks at this time in middle age? And how early should we be thinking about that?
I think that the big thing on falling is when we're in our younger years, like in our 50s, I look at that as being if you have risk for injury, then certainly being aware of falls can be a really big deal. Mm-hmm. And so the big things I always think about, Christy, will be if people are taking medications that would cause really significant adverse health outcomes if they fall, like blood thinners being a common one. If people were to fall and start to bleed, that might become a big issue or concern. And the big player here, of course, is bone health. If, somebody has osteoporosis, let's say they're in their late 50s or 60s, and they have that type of a risk, if they fall, they're more likely to be injured. So yes, I do think that people in their 50s and 60s should really be thinking about trying to prevent falls. Again, some of that's going to be environmental. A lot of that's going to be activity and straying that can really make a big impact on falls down the road.
Did you know that women typically spend the last 14 years of their lives navigating health issues? Research says we control about 70 to 90% of our health and longevity, but most women don't take advantage of all the ways to improve life and live longer. Mayo Clinic Press's new book, Ageless Aging, offers a new way for women to age while gaining wisdom, resilience, and experience. Take control of your aging journey today. You can buy Ageless Aging at mcpress.mayoclinic.org and use code AGING for 10% off your order today.
So speaking of impact, one place that plays a huge impact on falls is our home environment, right? Because homes are where falls actually happen the most. So Dr. Takahashi, what are the key areas in the home where falls seem to happen the most?
The bathroom is probably the most important area because
it's a slippery place.
It's a slippery area. You end up having to get in and out of a tub or a shower. You're bathing and you may be not completely aware. You may have soap in your eyes, other types of things that start to happen. People have to get on and off of a toilet. There's a lot of really challenging issues that go with the bathroom. Close to that, of course, is the bedroom, and that's getting in and out of the bed. So that dangerous zone is really that time at night when people say, I have to get up and go to the bathroom. So you combine that area where it's like, okay, you got to physically get up. You may be a little bit groggy. It's dark. You can't see. So you immediately lose one of those areas that help us with our balance, which is our vision. That's gone. And that's where you see a lot of folk will have that kind of risk in falling. So if you have to choose where do you make the biggest impact on your environment, think about the bathroom first. The bedroom is pretty close behind that.
And what about stairs?
Certainly stairs are on that list. People get weaker and it's harder for them to go up and down stairs. It becomes a problem. And so oftentimes when people are having to make a change in their housing situation, more times than not, it's going to be, I'm trying to eliminate stairs in the home.
Are there tools or adaptive equipment that can make the home atmosphere safer, such as in the bathroom and other assistive devices, lighting?
Yeah. Within the home environment, having something to help use your hands and your arms to help other than just your legs. And these are really straightforward and easy to say, oh, we're going to put up some grab bars within the shower. You can use shower chairs if you're really getting weak in your legs. Grab bars around the toilet can be helpful. Good lighting. Make sure you get good night lights in your bathroom and also in your bedroom if you need that. Those are really simple things that people can do that'll really help to prevent falls.
What about throw rugs? I have a love-hate relationship with throw
Oh,
rugs. I mean, they make the place look so nice, but gosh, when those corners start to curl, it's where
yeah.
they kind of add to that fall risk.
And that's a challenge because, again, most bathrooms you're going to have a tile or a laminate floor. So it's going to be slick. And people oftentimes say, oh, I'm going to put a rug down because A, it's cold, and B, you don't get all that water there. The problem is those things start to shift and they start to move, they curl. Ideally, we don't have them. But if you do, trying to have no slip, non-stick, and at least try to keep it as small as possible. Make sure it's closely adherent, low naps. You're not scuffing your foot over the rug. And other areas, if it's for decorative use, then I certainly would say try to avoid that at all possible.
I'm really glad you're mentioning these things because it's not often we think about these little items in our home that can make a big difference, and just changing a few things can really be a meaningful, proactive risk reduction strategy to help people stay safer at home.
Absolutely.
You mentioned earlier about medications. Do certain drugs increase the risk of falls in older adults, and what category of drugs are we looking at here?
A lot of drugs can cause problems with falling. And so the difficult thing, Christy, is many of these drugs have good need and have good use. And so the first thing on medication is making sure they're going to help you to either live longer or live better, right? So you really shouldn't take a medicine that doesn't do either of those. And sometimes medications that cause tiredness or sleepiness, those are the ones we probably worry the most about. And so try to avoid if possible. Most medications for sleep don't work very well after the first couple of doses, and they can cause a lot of problems that impair your balance. Sadly, that includes most of the medicines that are over the counter. A lot of diphenhydramine, Benadryl, and Unisom, and dicloxamine, antihistamines, those kind of medications are all problematic because they can affect your blood pressure and other things that can give people problems. Then you think about other medications like tranquilizer type of medications, things like for anxiety sometimes can cause problems. The tougher ones are medications like for blood pressure. Again, a very common
Right.
courses of medications, but you have to be really careful with it. So sometimes if people are having problems when they're using these medicines, you start feeling lightheaded or dizzy, making sure you're talking with your healthcare team and saying, we got to find the right balance here. So a lot of medications can cause difficulty.
And to add to that, I think the combination of medications as a whole,
Oh, of
as
course.
they age and more health issues surface and more meds are added to the mix, just at the adverse drug profile of multiple medications being utilized at the same time.
Absolutely. And that's where, everything gets to be added. So a little bit of medication makes me just a little bit sleepy. A little bit of medication has helped my mood or helps my depression. A little bit of medication here helps the pain in my feet. So you add all those up and all of a sudden, you're like, wow, you're at really high risk for falling.
So how can we help our caregivers and family members identify if their loved ones are at increased risk of falls? What are some warning signs that they can be on alert for?
I think the most important thing, which I think we all need to be aware of, is we see a loved one who's had a fall. Let's just start there first. That's a warning sign that, hey, we're starting to have falls. The other thing that comes up is be aware that when our loved ones are in their mid 70s or 80s, or they have other health issues, particularly any illnesses that cause problems with balance, I think we just have to be aware of that. Someone's had a stroke. Someone's had Parkinson's disease or cognitive issues that cause impulsivity. Those are always warning signs of just intermittently asking your loved one, hey, have you had any injuries? You've been falling? Any problems? How's getting up and getting around? How are things going when you're going to the bathroom, or how are things going when you're showering? Those type of simple things, just as a general type of discussion, is really critical for loved ones. If you start saying,
Right.
hey, there's a problem, bringing that up to the team and bringing it up to your loved one, saying, we probably need to get on top of this. We need to do some things to make it a little bit better for you.
So you've given us a lot of ways we can be proactive and reduce fall risk. But when it comes to fall prevention, there have been some situations where I see people going a bit extreme in the other direction. Sometimes, when older adults are experiencing the second or third fall, then they get scared. They're like, okay,
Right.
this is happening over and over again, and I'm just not going to move.
Right.
To prevent falling, I'm just going to sit on my chair and not risk getting up and falling. And so what would you say to someone, either an older adult or caregiver, who's afraid of falling and now is restricting their activity because of it?
Contrary to popular belief and contrary to what they want to do, the most important thing that people can do for their health is to be active and to exercise.
Mm-hmm.
And so even though you may be afraid of falling, the most important thing to do is to try to continue to build the strength and to do more walking and to do more activity. Because that's really one of those things that once people stop moving, it really spirals quickly into they don't move. And when they don't move, then they don't stay at home. And that's really a dangerous situation. So when people say, well, I want to have a lift chair, I want to start using a wheelchair, I want to start using a scooter, I think people need to be aware that, golly, that comes at the challenge that they're going to get weaker in their legs and they may be more at risk for falling. And so what we really want to do when people are afraid is get the confidence back, build yourself up. And there are other techniques too. Sometimes gait aids can be helpful, and that can make you feel a little bit more balanced with a cane or a walker. That helps out a lot in terms of you feeling more comfortable with getting up and getting around.
The topic of activity and exercise has been a very common theme among all of our podcast topics. And now we see that it also has a big role in fall prevention and reversing that fall risk. Between all the exercises out there, there's, resistance training and balance and strength, and there's weight training. What's a good target exercise activity for older adults to prevent falls?
So one of them is straightforward and easy, and that's just strictly just doing your walking, okay? Just the aerobic part of it and the strength part of it, just getting those steps in is really, really important. I think the most another important exercise here, again, is what we call a sit-to-stand exercise, which is basically you're sitting in a really good chair, doesn't swivel, with good arms, and just stand up. Just stand up out of the chair. So it doesn't require fancy equipment, no bands, nothing else. Just stand up and sit down and stand up again and sit down again. And if you can do that maybe 5 times, 2 to 3 times a day, you're building the strength in those muscles in your legs, and it gets easier and easier to stand up out of a chair or out of bed or off the toilet. Now, the other thing that would go closely beyond that is trying to work on balance. So strength and balance are a little bit different. And the balance is when you're like standing up with, let's say your feet are together, you're starting to have some problems. Just trying to do that and stand next to a chair or a table and kind of work on your balance exercise and just try to do that for 5 or 10 seconds or 15 seconds. Or if you can do it, you put one foot directly in front and just try to do that and stand without holding onto the table or the chair, and then try to build up your balance as you're going. And what you'll find over time is that you can do that a little easier. And so you're building those muscles in your hips and the adductors. So again, we can't easily fix the nerves in our feet and the nerves in our inner ears. We can fix the strength and the muscles in our legs and all of those kind of adductor muscles and things that help to stabilize us. We can work with those. The reason why you bring up exercise is the anti-aging medication, right? I mean, that's the only thing we know really helps with all aging processes is exercise.
And I think it's so encouraging to hear that from a provider is that, the whole mantra of if you don't use it, you lose it. If you use it, you can gain it back. And
That's
to
correct.
hear that from your doctor to say, you just have to do these things and you can at least maintain your function, if not make
Absolutely.
it better. I think a lot of people are discouraged because as they become less mobile, then they find themselves sitting more and it's like you can't get that back anymore, which is untrue. It's not true.
Exactly. I'm always a believer, we try to fix what we can fix and we try to change what we can change. There's always an option. There's always a way to make things a little bit better than where we're at.
Right.
And certainly the activity part of this is certainly there. And again, there are numerous studies that, yes, people do make gains. They're in the nursing home, 90-year-old people. They do strength training on those folk and they get better and they get stronger. So, it's not like, oh, you're at a certain age, you never gain muscle. I mean, you can always gain muscle. And you can always make things better. And again, we've seen this over and over and over again. So it's worth the 10 minutes a day to do these activities. It's really worth it.
As far as a prevention plan and how you guide your patients through that, obviously talking about exercise, what are other components of a comprehensive fall prevention plan? What else should it include?
So certainly the activity component is going to be the absolute bedrock of what we talk about. Then we start getting into other really big components. Nutrition's on that list as well, because if you're losing weight, you're not eating well, it's hard to regain muscle and it's hard to maintain muscle. So people have to eat well, and that includes protein, making sure people are eating and they're maintaining their weight. The other thing which we haven't talked a lot about here is other injury prevention parts, which means bone health is really on my list as well. If they've had any osteoporosis, making sure that's going to be treated. And the toughest one probably is this discussion on when you're on blood thinners. Is it reasonable to be on the blood thinners or not? And I think more times than not, it probably helps prevent that stroke. And we may say, hey, we want you to stay on it, but just being aware of that or making sure the monitoring's doing okay if they're on something like a warfarin, but also just make sure you're doing it right and doing it properly is going to be important. It's a multi-pronged approach because falls is not just one thing, it's many things. So we try to fix all of that.
Yeah, sometimes it's hard to fix all of it, but even targeting one or two pillars can make such a big difference.
Absolutely.
Dr. Takahashi, you've seen many older adults throughout your career, and you've seen a lot of fall situations. Can you share any success stories of older adults who've significantly reduced their fall risks through specific intervention, and you've seen some good outcomes through that?
Yeah, absolutely. And the biggest joy that I have is talking to people who are still in their homes, saying, you know what, I got back home after my injury. I've started working on this. I'm starting to do my walking plan. You told me about doing this sit-to-stand exercise thing. And you know what? I started doing that at home. I can actually do it now. And they show me it. They get in a bench and they stand up and they're like, wow, that's awesome. It makes you feel like, okay, it's worth the extra few minutes to talk about these things because it really does help.
I love that. Thank you so much for just showing us that there's hope for situations where it seems like it's hopeless, but that there's so many things we can do proactively to reverse that and improve that. And you are clearly the expert here. We would love to know, what do you do to personally age well?
I think that the most important thing I've done is I try to live every day, Christy, with the most important anti-aging medication, which is exercise. So I've made that a priority since I was a geriatric fellow, actually, way back in 1997. So it's been a long while. But every day, even days that are busy, days that are lots of busy, try to get that exercise in every day. So what does that involve, Christy? That involves three things. It involves, number one, getting that aerobic in. So I run, but walking, I've done that in the past too, or hiking or doing something aerobic every day. Some strength training, try to get a little bit of that as well. And increasingly, I'm working on balance, which means we try to stand on one foot while you're brushing your teeth, or I'm trying to work a little bit on some core exercises. That's probably the number one thing I keep thinking that every day when I put my to-do list together, Christy, I put those top three things on there. I put on run and core and strength.
Thank you so much, Dr. Takahashi, for sharing your wisdom with us today and your expertise in fall prevention, for making such a complex issue much simpler for us to understand, what we think is irreversible to be reversible and preventable so we can live longer and healthier lives. So thank you so much for being here today.
Happy to help.
So that's all for this episode. Hopefully you're feeling a little bit more informed, inspired, and empowered. If you have a topic suggestion for a future episode, you can leave us a voicemail at 507-538-6272, and we might even feature your voice on the show. For more Aging Forward episodes and resources, head to mayoclinic.org/agingforward. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps others find our show. Thanks for listening, and until next time, stay curious and stay active.
Have you ever wondered how artificial intelligence is helping solve medical problems, or how medical research is making it easier to predict your genetic risks for disease? Hi, I'm Kathy Wurzer. Tomorrow's Cure, a podcast from Mayo Clinic and PRX, is back for Season 2. Join me as I interview experts who are shaping the future of healthcare with groundbreaking advancements. What they describe may sound futuristic, but listen and you'll find out. Tomorrow's Cure is already here. Find it now wherever you get your podcasts.
This podcast is for informational purposes only and should not be relied upon as medical or legal advice. Always consult with a qualified healthcare provider for any medical questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions are those of the speakers and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity does not constitute an endorsement of or recommendation by Mayo Clinic.